Let us start. Question number 1. Normal reticulocyte count. Option A 50 to 100 into 10 raised to 9 per liter. Option B 4 to 11 into 10 raised to 12 per liter. Option C 3 to 5 into 10 raised to 12 per liter. Option D 6 to 12 into 10 raised to 9 per liter. We know that the normal range of reticulocyte count is 2.5 to 5%. Okay, but here the question is that what is the normal range per liter? Here the right answer is option A 50 to 100 into 10 raised to 9 per liter. 50 to 100 into 9 raised to 10 raised to 9. Next question. The coagulation factor not involved in intrinsic pathway of blood coagulation. Option A factor 9. Option B factor 7. Option C factor 8. Option D factor 12. The right answer is option B factor 7. Next question. Basophilic stippling occurs in option A thalassemia, option B megaloblastic anemia, option C lead poisoning, option D all of the above. Basophilic stippling means small basophilic granules on RBC. This is appeared in thalassemia, megaloblastic anemia and lead poisoning. So the right answer is option D all of the above. Next one, reducing agent used in sickling test. Sickling test means detection of sickle cells or sickle shaped RBCs or crescent red cells. Options potassium sulfate, sodium metabisulfate, sodium nitroprusside and sodium hypochlorite. The right answer is option B sodium metabisulfate. Next question, hypersegmented neutrophils are found in option A iron deficiency anemia, option B acute lymphoblastic leukemia, option C macrocytic anemia, option D acute mycogenous leukemia. The right answer is option C macrocytic anemia. Hypersegmented neutrophils are found in macrocytic anemia. Next one. Question number 6. Which of the following are used as prostatic marker? We have acid phosphatase, citric acid, zinc and option D all of the above. We know that a common or important prostatic marker is acid phosphatase or ACP. Along with ACP, citric acid and zinc are prostatic markers. So the right answer is option D all of the above. Next one, question number 7. Reagent used for detection of ketone bodies by dipstick method. Option A sodium nitroferricyanate, option B ferric chloride, option C potassium iodide, option D orthotoluene. The right answer is option A sodium nitroferricyanate. Sodium nitroferricyanate reagent is coated on dipstick. Dipstick is a strip in which reagent is coated and which can be used for various parameters. For ketone body detection, the strip coated with sodium nitroferricyanate is dipped in urine and wait for a few seconds, then the color change developed is measured against a color chart provided. So the right answer is option A sodium nitroferricyanate. Next question, which of the following organisms are destroyed when CSF samples are refrigerated? Option A Streptococcus pneumoniae, option B Neisseria meningitidis, option C E. coli, option D Salmonella typhi. The right answer is option B Neisseria meningitidis. Neisseria meningitidis will be destroyed on refrigerating CSF samples. Question number 9. Black tarry stools are indicative of obstructive jaundice, cholera, gastrointestinal hemorrhage, food poisoning. The right answer is option C gastrointestinal hemorrhage. In obstructive jaundice, there will be no color to the stool because of the lack of urobilinogen. Next question. Foul smelling sputum is observed in option A bronchiectasis, option B pulmonary edema, option C asthma, option D pneumonia. Next question. Cryoprecipitate is administered to the patient suffering from which of the following condition? Hemophilia, thrombocytopenia, leukopenia, von Willebrand's disease. The right answer is option A, hemophilia, and option D, von Willebrand's disease. Cryoprecipitate is administered to the hemophilia and von Willebrand disease patients. Next question is membrane stabilizer used in SAG-M blood bags. Option A, mannitol. Option B, dextrose. Option C, adenine. Option D, citric acid. The right answer is option A, mannitol. Mannitol is used as membrane stabilizer in SAG-M blood bags. Next one, which of the following immunoglobulin crosses the placenta? Option A, IgM. Option B, IgA. Option C, IgE. Option D, IgG. The right answer is option D, IgG. IgG is the old immunoglobulin that can cross placenta. Next question, which of the following statement is correct for Bombay blood group persons? Option A, persons with Bombay blood group carries H antigen. Option B, Bombay blood group persons cannot receive O blood group. Option C, Bombay blood group is detected using forward grouping. Option D, Bombay blood group persons lack anti-H antibodies. Here, the first statement, persons with Bombay blood group carries H antigen, is wrong. Then the next statement, Bombay blood group persons cannot receive O blood group, is correct. Bombay blood group is detected using forward grouping. Bombay blood group persons lack anti-H antigens are wrong statements. So the right answer is option B. Question number 15. Anti-A1 lectins are extracted from option A, Ulex europaeus. Option B, Vicia graminea. Option C, Dolichos biflorus. Option D, Archis hypogea. Here, anti-A1 lectins are used, the reagents used to distinguish between A2 and A1 red cells. A1 red cells from other subtypes of red cells, and it is extracted from a seed which is known as Dolichos biflorus. So the right answer is option C, Dolichos biflorus. Next question, microtome which is ideal for cutting sections of very large blocks of tissue. Here the right answer is option B, sludge microtome. Sludge microtome is used for cutting very large blocks. For large blocks, sludge microtome is used. Next question, all are mercury containing fixatives except option A, Hayden-Hine-Sousa. Option B, Zenger's fluid. Option C, Haley's fluid. Option D, Genders fluid. Not Janders, it is Genders. Here, Hayden-Hine-Sousa, Zenger's and Haley's are mercury containing fixatives, while Genders fluid is a picric acid containing fixative. So the right answer is option D, Genders fluid is not a mercury containing fixative. Next question, best mounting media for fat stains. Option A, Epathy medium. Option B, DPX. Option C, glycerin jelly. Option D, Canada balsam. The right answer is option C, glycerin jelly. Best mounting media for fat stain is glycerin jelly. Next question, all are true about frozen section except option A, structural details may become distorted, serial sections can be obtained, polychrome methylene blue can be used for staining, adhesive not required for unfixed tissue. Here, let us check the statements. First statement is right, structural details may become distorted. It is right about frozen section. The second statement, serial sections can be obtained. It is a wrong statement. Serial sections cannot be obtained by a freezing microtome. And the third option, polychrome methylene blue can be used for staining, is right. and adhesive not required for unfixed tissue is right. So the right answer is option B. Serial sections can be obtained is not correct about or true about frozen section. So the right answer is option B. Coming to the next question. Following are special stains for hemosiderin except option A, Terman-Schmelzer's turn blue technique, option B, Pearl's Prussian blue, option C, Glenner's method, option D, Stain's method. Which is not a hemosiderin stain? Here turn blue technique, Persian blue technique and Glenner's method are the special stains used for hemosiderin. Stain's method is not for hemosiderin. So the right answer is option D, Stain's method. Next one. All are true about sex chromatin except. All are statement type questions. So be careful while answering. Option A, buccal mucosal scrapings from inside the cheek is obtained for sex chromatin study. Next one, the most reliable staining is hematoxylin and eosin. Option C, fixative used is equal parts of ether and alcohol. Option D, sex chromatin is seen as intensely staining dot lying against the nuclear membrane. Buccal mucosal scraping from inside the cheek is obtained for sex chromatin study. It is right statement. The most reliable staining is hematoxylin and eosin. It is not hematoxylin and eosin. The best stains are acetoorsin, fast green, etc. Then the next option, fixative used is equal parts of ether and alcohol, and the sex chromatin is seen as intensely staining dot lying against the nuclear membrane is right. So the right answer is option B. Most reliable staining is hematoxylin and eosin is a wrong statement about sex chromatin. Next question. All are nuclear fixatives except option A, newcomer's fluid, option B, Clark's fluid, option C, Carnoy's fluid, option D, Champy's fluid. Here the first three options are nuclear fixatives: newcomer's fluid, Clark's fluid and Carnoy's fluid. They are nuclear fixative, but Champy's fluid is a cytoplasmic fixative. The question is that all are nuclear fixative except. So the right answer is option D, Champy's fluid. Next question. All are true about Shore staining except. Option A, used for hormonal assessment. Option B, not very useful in detecting malignancies. Option C, nuclear definition and cytoplasmic transparency is better than Pap stain. Option D, contain Beveridge scarlet, orangey and fast green. Here option A is true about Shore staining because it is used for hormonal assessment, and option B is also correct. It is not very useful in detecting malignancies. And option D is true about Shore stain. It is contain Beveridge scarlet, orangey and fast green. So the right answer is option C. Nuclear definition and cytoplasmic transparency is better than Pap stain is a wrong statement about Shore staining. Next question. NaF solution in cell block technique contain option A, formaldehyde, option B, glycerin, option C, ethanol and option D, eosin. The right answer is option B, glycerin. NaF solution in cell block technique contains glycerin. Next one. All are advantages of liquid based cytology except. Option A, number of slides per patient are reduced. Option B, improves the background of microscopy. Option C, improves cell preservation. Option D, cause drying of cells during preparation. All are advantages of liquid based cytology except. Which are the advantages? The number of slides per patient are reduced, improves the background of microscopy and improves cell preservation. So the except option is option D, cause drying of cells during preparation is not true about liquid based cytology. Next question. In karyotyping, shortest acrocentric chromosome are seen in which group? Option A, B group, option B, D group, option C, E group, option D, G group. The shortest acrocentric chromosome. The right answer is option B, D group. Next question. Y chromosome is a dash chromosome. Option A metacentric, option B submetacentric, option C centric, option D acrocentric. The right answer is option D, acrocentric. Next question. Question number 28. Which banding technique employs fluorescence for chromosomal studies? Option A G banding, option B Q banding, option C C banding, option D H banding. The right answer is option B Q banding. The technique which employs fluorescence for chromosomal studies is Q banding. Next one. Turner syndrome is option A XXY, option B 48XXY, option C X0, option D 49XXY. Turner syndrome is 45X0. So the right answer is option C, X0. Turner syndrome is X0. Next question. Most commonly employed mitogen for chromosome preparation from blood culture, whole blood culture. Option A phytohemagglutinin, option B lipopolysaccharide, option C concanavalin A, option D pokeweed mitogen. Which mitogen is used for chromosome preparation from whole blood? The right answer is option A phytohemagglutinin. Next question. Which of the following is a high level disinfectant? Option A 70% ethyl alcohol, option B hydrogen peroxide, option C quaternary ammonium compound, option D phenol. The high level disinfectant is bleach plus hydrogen peroxide. So the right answer is option B hydrogen peroxide. Next question. Who is known as the father of antiseptic surgery? Option A Joseph Lister, option B Louis Pasteur, option C Edward Jenner, option D Robert Koch. The right answer is option A Joseph Lister. Father of antiseptic surgery is Joseph Lister. Next question. Polymerase chain reaction or PCR was developed by option A Ernest Ruska, option B Rosalind Yalow, option C Carrie B. Mullis, option D Carl Landsteiner. The right answer is option C Carrie B. Mullis. PCR was developed by Carrie B. Mullis. Next question. Which of the following is not a feature of electron microscope? Option A virus can be detected, option B the object appears bright against a dark background, option C intracellular structures of bacteria can be seen, option D electromagnet lens is used. The first option virus can be detected is true about electron microscope. The second option the object appears bright against a dark background. This is not about electron microscope but it is about dark field microscope. Then the next statement intracellular structures of bacteria can be seen. It is true. And the next electromagnet lens is used is also true. So the right answer is option B. The object appears bright against a dark background is not a feature of electron microscope. Next question. Infectious plastic waste should be segregated in which color bag? Option A white, option B yellow, option C blue, option D red. The right answer is option D red. Infectious plastic waste should be segregated in red color bag. Next one. Which of the following is an anaerobic medium? Option A thioglycolate broth, option B selenite F broth, option C bile broth, option D tetrathionate broth. Right answer option A thioglycolate broth. Selenite F broth, bile broth and tetrathionate broth are aerobic culture media. Next question. Multiple ring forms are the characteristic feature of option A. Plasmodium vivax, option B. Plasmodium falciparum, option C. Plasmodium ovale, option D. Plasmodium malariae. Multiple ring forms. The right answer is option B. Plasmodium falciparum. Next question. Which of the following has no cystic stage? Option A. Trichomonas vaginalis, option B. Giardia lamblia, option C. Enteromonas hominis, option D. Diendamoeba fragilis. The right answer is option A. Trichomonas vaginalis. Which of the following has no cystic stage? Trichomonas vaginalis has no cystic stage in their life cycle. Next question. An AIDS patient came to the outpatient department complaining loose stools. On acid-fast staining, stool showed 4 to 6 micrometer size oocyst. The probable diagnosis is option A. Cryptococcosis, option B. Cyclospora, option C. Cystoisospora, option D. Cryptosporidium. The right answer is Cryptosporidium because Cryptosporidium have oocyst. The oocyst is 4 to 6 micrometer size. So the right answer is option D. Cryptosporidium. Next question. Which of the following is not a nematode with small intestine as habitat? Option A. Ascaris lumbricoides, option B. Ancylostoma duodenale, option C. Enterobius vermicularis, option D. Necator americanus. The right answer is option C. Enterobius vermicularis because it habitates large intestine. The question is that nematode with it small intestine. So the right answer is option C. Enterobius vermicularis. Next question. Larva occurrence is caused by option A. Toxocara canis, option B. Toxocara cati, option C. Ascaris lumbricoides, option D. Strongyloides stercoralis. Larva occurrence is caused by Strongyloides stercoralis. Right answer option D. Next question. Which of the following do not float in saturated salt solution? Option A. Fertilized egg of roundworm, option B. Unfertilized egg of roundworm, option C. Ovum of pinworm, option D. Ovum of hookworm. Fertilized egg of roundworm, that is of Ascaris lumbricoid, it will float. Then ovum of pinworm, that is of Enterobius vermicularis, it can also float in saturated salt solution. Next, ovum of hookworm, that is of Ancylostoma duodenale. These three can float in saturated solution, but unfertilized egg of roundworm, that is unfertilized egg of Ascaris lumbricoides, do not float on saturated salt solution. So, option B is the right answer. Next question. Diarrheal stool with rice water appearance is a characteristic feature of which disease? Rice water appearance. Option A. Typhoid, option B. Bacillary dysentery, option C. Cholera, option D. Traveler's diarrhea. The right answer is option C. Cholera. Next one. Inverted fir tree appearing growth pattern in gelatin stab culture is related to option A. Bacillus anthracis, option B. Yersinia pestis, option C. Pseudomonas aeruginosa, option D. Bacillus cereus. Inverted fir tree appearing growth pattern on gelatin stab culture. It is possessed by Bacillus anthracis. The right answer is option A. Bacillus anthracis. Today we are winding up. You can watch the previous videos from playlist, and if you are watching without subscribing, please do subscribe. Thank you.